Ladies and gentlemen, distinguished guests, for those who don't know me, my name is Marwan Abdulaziz Janahi, Senior Vice President of Dubai Science Park, part of TCOM Group. As I stand here today with the world shaping COP28 serving as a backdrop, I want to emphasize the crucial link between sustainability, healthcare, and medical technology, a nexus that demands our immediate attention. Healthcare and sustainability are inseparable, and it is important to acknowledge the efforts needed so that healthcare sector contributes to positive climate action. From energy consumption to waste generation, its impact is substantial, and we must integrate eco-friendly practices into our industry to achieve global sustainability goals. It is equally important to recognize that climate change affects health. Be it new diseases or extreme weather events, climate risks are health risks. Sustainable healthcare involves preparing for these scenarios to build long-term resilience with a proactive approach. The recently released Lancet Countdown report shows heat-related deaths in people aged over 45 have increased 85% compared to during 1990 to 2000. Addressing how to mitigate the impact of our industry on the environment is essential. To embed longevity and sustainability in future healthcare, this needs collaborative innovation, which we nurture at Dubai Science Park by uniting more than 450 industry leaders and over 5,500 professionals from life, energy, and environment sciences, as well as connecting them with TCOM's group's vast sector-specific ecosystem, be it researchers at Dubai Academic City, technologists at Dubai Internet City, or manufacturers at Dubai Industrial City. Such collaboration is helped along by strategic support available in Dubai through strategies such as Dubai R&D program and the Dubai Economic Agenda D33, and we are the UAE 2031. This kind of interaction is essential to foster game-changing innovation that can secure a sustainable future for our industry, whether it's telemedicine that enhances accessibility and minimizes carbon emission, recycling technologies to curb the impact of healthcare-related waste, or AI that enables predictive and personalized medicine. To nurture such knowledge sharing, we at Dubai Science Park are collaborating with EY to produce a white paper that reimagines the future of healthcare in the UAE and beyond. The paper explores what a sustainability-conscious future looks like, from not just an environmental, but a human lens. These findings are contextualized in the backdrop of COP28, a pivotal moment in the global commitment to enhancing positive climate action. As the international committee intensifies these efforts, our upcoming white paper with EY highlights how the healthcare sector can leverage sustainability to build a healthcare ecosystem that is not only responsive to the needs of today, but also resilient in the face of tomorrow's uncertainties. It is with this in mind that Dubai Science Park is today hosting a special edition of Advanced Health Forum here at COP28. Advanced Health is a pioneer of dialogue and collaboration that leads a long-term industry advancements. This session of Advanced Health will focus on innovating healthcare while also preserving our environment. So without further ado, I thank your time and presence today and invite to the stage the moderator, Ahmed Benna, who is the Senior Manager of Healthcare Business Consulting at EY. Ahmed, the floor is yours.
It's very good to see many common faces among the audience today, and for those who we haven't been acquainted before, it's a pleasure to meet all of you. Welcome to Dubai if you're not a citizen or a resident of the country, and if you are, it's good to see you again at the Expo site. Sustainability in healthcare. It took 27 rounds of COP to introduce healthcare as a focus area for sustainability. But why? Why was that the case? And what brings us all here today? Let's think of some numbers. If you look at the global toll of deaths that are expected to happen or has happened in 2016, that comes up to 13.7 million deaths due to environmental factors. The toll of that comes up to around $3 billion by 2030. Around 5% of the global greenhouse gas emissions that are produced are because of healthcare. And there is a massive footprint that healthcare is producing in this field. The UAE has announced that the net zero emissions target will happen by the year 2050, which is an ambitious promise. And we can see many measurements, including this COP28, to achieve that. When it comes to us, we have proudly been carbon neutral in December 2021, and EY promises that by the year 2025 we'll be net zero. Let's think about the core of healthcare. The core of healthcare is around the patient. It's around people. It's around practitioners. It's around who really interacts within the healthcare ecosystem. When it comes to the healthcare ecosystem, we've done a very small survey. The survey was with around 6,000 people in 6 different countries, including the US, Germany, Canada, Australia, and Ireland. The results were astonishing, to be honest. Personally, when I read it, I feel astonished. Only 4% thought this was important, sustainability, and 70% has scored sustainability in 70% or less importance. This negligence or this fact that healthcare practitioners, patients, and people within the ecosystem don't hold healthcare sustainability as an important matter adds to the problem. We should all do something about that. It's important also to mention how global and local factors are converging to create burden and create a call for action when it comes to healthcare. You can see things like the rising global threats and associated opportunities from climate change that are emerging. You can see a major shift in stakeholder capitalism, not just because of shareholders' value, but now we're also talking about ESG reporting and criticality to what sustainability means for corporates. There's an increased stringent regulations that are being raised and produced daily on different governments, by different governments on different healthcare sectors to improve sustainability and healthcare. There is a massive need and a fight for social equity and social justice and accessibility to funding and access to good quality care. Talent and customer attraction is important when we talk about the S and the ESGs. We're talking about the social element and the social impact of people who work within a healthcare ecosystem, and how diligent my employees, my patients, my drivers, everybody who is one way or another involved in the healthcare ecosystem understands social equity and understands sustainability. Sustainable investing is moving from a niche market to a mass market and it's becoming something that everybody is looking at. With Dubai Science Park, we've identified sustainability as a key trend that is changing the face of healthcare globally. Health services will be delivered in more resilient and sustainable ways. Capacity will be built to achieve sustainability goals and to achieve a future-proof health system throughout self-sufficiency. When we think of self-sufficiency and when we think of sustainability, don't think just of temperature. Don't think of environment only. There are 3 elements. There is social, environmental, and economic. When we talk social, we're talking social justice and access to care and equity. When we talk around environment, we're talking about emissions and of carbon footprint that's being generated by all players in healthcare. 70% of emissions in healthcare happen downstream and upstream, the manufacturing of raw materials and the supply of those materials and drugs to the consumer. When we think of COVID-19 and the impact that it has had, think about the single-use instruments and where they go afterwards. Think about the environmental impact of those single-use devices. So as healthcare, we need to find a solution that maintains the control for infection and maintains our standards of care, but also considers the environment and helps all the players have economic impact and economic value at the same time. There are 8 measures and key initiatives that we explore in the white paper. We explore low to no energy cost energy conservations. We talk about the leadership in energy and environmental design. We explore renewable energy. We explore cybersecurity transformation projects. We explore social responsibility, enhanced governance, smart supply chain and procurement, and last but not least, the massive megatrend, digitization of healthcare. I'll leave you with a very simple thought before we move to the next speakers, and that is around sustainability is everybody's business. Think about yourself. How will this play out in the UAE healthcare system, in your healthcare system, the larger healthcare system, and the globe at a larger scale? Thank you very much. Today we have 4 distinguished speakers, and each one of them will bring a very interesting aspect of sustainability. I would like to start and invite us to the stage Mr. Jamie Ireland, the Senior Vice President at THB Group. Please join us.
My name's Jamie Ireland. For those of you that don't know me, I'm the Senior Vice President of THB Group. So thank you very much, everybody here, for coming here today. Today, I'm going to be talking a little bit about sustainable healthcare and how health tech can contribute towards sustainable healthcare. So I think the first question we need to ask, what does sustainable healthcare mean? I think everybody here today is going to hear quite a lot about different viewpoints of sustainable healthcare. So I looked this up, and the WHO has a very specific statement around sustainable healthcare. So a sustainable healthcare system is one which improves, maintains, or restores healthcare whilst minimizing the negative impact on the environment. And it takes opportunities to restore and improve the environment for current and future generations. And this is an incredibly important statement, especially within healthcare. So Marwan very kindly mentioned the Lancet report. One of the elements that the Lancet report also stated was that healthcare as an industry is the 5th largest contributor to carbon dioxide release globally. If healthcare were a country, it would be the 5th largest country globally in terms of pollution. That equates to a country roughly the size of Japan with 126 million people. So what can we do, and how can health tech support building, managing, maintaining a sustainable healthcare ecosystem? So traditionally, healthcare has been a place-based endeavor. People have gone to hospitals, gone to clinics, gone to their GPs, traveled meters, miles, hundreds of miles in some cases to get the healthcare that they need. Is a place-based system the right thing moving forward? And if not, how can digital initiatives support that transition? The future is personal, inshallah. We've been told about how the future, personalized health, it's coming. Everybody's going to get medications attuned to them. Our healthcare providers are going to know who Jamie is, what his conditions is, and what he needs from healthcare. Are we there yet? I'm not so sure. Healthcare organizations globally are sitting on treasure troves of data. I was speaking to the government of one of the regional countries here in the region, and they have more than 23 years of structured longitudinal data on all of their citizens. And they're not using that data today yet to provide data-driven insights into improving healthcare delivery. What can we do? I think everybody knows that COVID-19 really accelerated the adoption of health tech. People were more comfortable going on teleconsultations, having a conversation with their physician, which was recorded and then transcribed into their care record. People were very comfortable not having to travel hundreds of miles to get care delivery. So technology is already having a measurable impact on healthcare globally, and people now are a lot more comfortable working with technology in healthcare. It's reducing the need to travel. It's transforming the way that information is documented, and it's optimizing interactions between caregiver and care provider. Having my physician know all about me from my interactions with my GP, with my dentist, with my clinical history is a big game changer, and it gives me as a citizen a lot more confidence. Now, to give you some idea of the scale, a typical mixed consultation, which is a combination of physical and virtual, emits around about 52 kilograms of carbon dioxide. Now, a fully in-person consultation clinic emits about 78 kilograms of carbon dioxide. So a really big change just on a mixed partial change transition from physical to mixed. This changes even more measurably when you come to do an individual one-to-one consultation. So typically a one-to-one consultation conducted in person with your care provider represents about 7 kilograms of carbon dioxide released into the environment. If we change that to virtual, it's less than 1 kilogram. So a really, really big change, really big transition. So is virtual healthcare the panacea that we all hope? Maybe, but maybe not. One of the challenges with virtual is losing that human touch, is losing that interaction between care provider and caregiver. So some statistics to sort of really drive this home is there's been a lot of reviews since COVID-19 around the longitudinal care journey and the interactions with caregiver, care provider. So statistics of up to 28% of booked virtual consultations don't take place because either the care provider or the actual patient don't attend that session. When it comes to returning patients around chronic conditions, that's as high as 13%. So people with chronic conditions, up to 13%, don't attend those scheduled appointments and visits. So from a long-term engagement, how can we work with healthcare organisations to address these care gaps, close it, and move to a much more personal position? As I mentioned, the future is personal, and it needs to be personal. There's been a huge amount of promise around things like personalised medicine. So organisations take that rich cohort of data around an individual, that longitudinal care pathway that we all have, and it's all represented, and also the 3.2 billion lines of base code that make up the human genome to drive personalised therapies at a very, very granular level. But I don't think enough work is being done to make the future of healthcare personal. How can we make sure that every interaction between caregiver and care provider, the care provider knows all about me as an individual? All of the people within my care journey know about me, and I don't have to provide more information about who I am, what I do, what interactions I've had, and summarise previous engagements with care providers. So this is a big piece of work that THB has worked on. How do we support that interaction and that engagement between care provider and care recipient? So we've created a longitudinal platform which looks to address those care gaps. So looking at how care providers can understand me as an individual, how we can start to predict and forecast when people are going to engage, when they're not going to engage, and making sure that they adhere to care pathways and medicines to drive the best outcomes. Now, utilising this data platform, we've been able to address and drive that interaction between caregiver and care provider by more than 16%. And the consequence of this from a sustainability perspective is that they need up to 30% less engagements with their care providers over that longitudinal care journey, especially around chronic disease. So if we look at that from a travel perspective, they're saving more than 11.5 kilograms of carbon dioxide release per patient per year. So if we can make the future of healthcare personal, we can really drive these changes on sustainability. Now, the third area I'm going to talk about is everybody's favorite area, data. You know, it's been mentioned a lot here today, how do we use data to really drive towards insights? But more importantly, how do we get towards knowledge? Insights are great, but we really need to transform and transition towards knowledge. Analytics, advanced analytics, will help us really understand what is happening and why something's happening. But advanced analytics can really take that to the next stage. How do we predict what's going to happen based on the interventions that we're actually infusing into a system? How do we provide prescriptive information around what the next steps and actions should be from a population health perspective to an individual care provider's engagement with an individual in a one-to-one clinic? So we work extensively through healthcare organizations and pharmaceutical organizations, along with many of you in this room. And we work with these organizations to build a data profile to provide a full 360-degree view of the patient, and in some cases, the care provider. And what this does is this allows, at a glance, all of that data to be curated, the analytics to be utilized on it to understand the what and the why, but also we then start to run predictive analytics so we can then support that interaction between care provider and patient with prescriptive next best actions, which are provided via a whole variety of means, including everybody's second favorite talking point today, which is generative AI. So how do we drive these really highly personalized interactions? I'm just going to give you one more example of a leading children's hospital, which has used this to great effect. So anesthesia gases hold more than 2,500 times more heat than carbon dioxide. So this was a major area of focus for this large children's hospital. So they used a data-based approach to analyze how anesthesia gases were used across their organization. And they used historical data, but real-time analytics to understand just small interventions that they were driving to try and reduce the amount of anesthesia gases that they were releasing. Now, over a 5-year period, this became a dedicated practice in its own right. So with the application of this data, they were able to drive an 87% reduction in anesthesia gases, which is incredible. So that represents more than 500,000 kilograms of carbon dioxide equivalent not released into the atmosphere every single year. And as my colleague Ahmed mentioned, this is very much around sustainability, but there is also the financial metric here. Now, they're saving more than $175,000 every single year by that reduction. So data to improve healthcare outcomes, to improve sustainability, and also to reduce the cost to care. A quick audience participation session. Who's heard of Jon Snow? This Jon Snow? Well, unfortunately, this isn't the Jon Snow I'm going to talk about. I'm going to talk about one of my heroes, this Jon Snow. So Jon Snow was a 19th century British clinician. He was born in 1813, was working on one of the biggest cholera outbreaks in 19th century London, and he suspected that this was a waterborne disease. But the general consensus at the time was it was not a waterborne disease. So Jon Snow used a simple map and a simple pen to identify and plot in a single geographical area cholera deaths. He then cross-compared this to a number of other cholera deaths in other geographical areas around London. And he was able to identify without any doubt that the Broad Street pump in the middle of this graph was the culprit of the cholera outbreak in 19th century London. This is the first generation to feel the impact of climate change, and it's the last generation that can do something about it. Thank you.
All right, so next to Michael Schoenberg. Michael is the Senior Vice President of Corporate Development at Data Centers. Michael, please go ahead.
Airplanes themselves are a fully system integrated approach. All the data is being utilized to predict, to ensure the safety of the passengers to arrive at the destination, typically also on time, if there's nothing that comes in between and we are delayed. But ultimately, it is a thing that we are really believing in, that we're trusting in. Now we're getting into the automotive industry. Cars are by now pretty much computers on wheels, and they're advancing year on year, and we are getting to a system integrated approach. But talking about the operating room, that is the second most dangerous place on the planet after the battlefield. And that means we really have to do something about it. And the only way that you can do something about it, and back to what Jamie shared as well, is to create insights, to create knowledge out of all the data points that we already have. We have to integrate the information that is available outside of the operating room. Think about the electronic and medical records. Think about the supply chain system, laboratory information system, radiology information system, and the list goes on. And then you get insight into the operating room, and it gets a bit more tricky. You have to integrate medical devices, you have to integrate cameras, scopes, and many other things. But that is the only way that you can actually positively impact the financial, the operational efficiency, elevate clinical proficiency, and generate real-world data and real-world evidence in order to come up with the insights that are so relevant for the entire healthcare ecosystem, even beyond that for the medtech industry, but then ultimately to take informed decisions of what needs to be done to positively impact sustainability. Because our planet's health and human health go hand in hand if we were to make sense of the data that we're sitting on. And I want to actually look at 5 different focus areas. The first one is energy consumption. We have to tame this beast of this operating room energy hungry thing that we are somehow having in a lot of health facilities by making sense of data analytics and data that we have there. At the same time, we have to line up the resources effectively in order to operate these very heavy assets, but also to ensure that we only utilize what is actually needed. And that brings me to the waste generation. Why do we open up so many sterile packages that generate this 80% of solid waste before the surgery happens? Well, we do that to ensure that we have the lowest possible risk for a patient, because we do not yet know exactly what has happened with the patient, what are all the things that were tried, what is yet now particularly important for that surgery for every single step. And if we were to bring that data together, we can avoid opening a lot of these sterile packages. With that, we can avoid a lot of the waste. And the only way to do that is actually to look at how can we be more effective and efficient from an operational standpoint, lower the risk, lower complications, make sure that we have as minimal variance as possible to have the best possible throughput and take informed decisions and give the right guidance to the ones that really need it, which are the clinical practitioners, the nurses, the ones that can be the superhero caregivers if we enable them with the right data. Which leads me to the 5th point, which is something that we can never compromise on, which is patient safety, to improve the outcomes towards value-based care. So now you might ask yourself, all right, so these are a lot of different focus areas and categories. How is that possible to even generate any results? And we are fortunate enough to work with the change makers around the world, the ones that are really forward-thinking and are driving this digital transformation forward. And through that, we're able to generate about 60% reduction in energy consumption for operating rooms, particularly for the ones that are idle. So why do you have to run it at the same level with all the systems when there's an idle period? So you can adjust that if you have the insights. But at the same time, it's also, again, about operational and surgical improvements. If you were to create these improvements, you reduce the variability, you eliminate any particular delays. You can have in one of these assets, which is the operating room, 33% more surgeries on an annual basis. So just do the math. If you have at the same facility 33% more, what does it do with the carbon footprint per surgery? That already drastically reduces it. So now combine that with the efficiency you can create by reducing the waste. And then you also look at how can you reduce what happens to the healthcare ecosystem, such as risk, complications, readmissions. You have a multiplication effect on what is happening to healthcare expenditure and how that contributes to global carbon emissions. We are very fortunate and grateful that there are a lot of institutions around the world that work together with us on making that vision become reality. So far, we managed to generate over 750 million of structured data points out of structured and unstructured data. with that, generate the insights to really enable decision-taking and improve how we can provide care, how we can really advance what is happening in the surgical continuum, and at the same time do it in a much safer way. Because the only way that we can do that is we have to do it together. We have to work together on systematically improving surgery. At the same time, we can help save millions and millions of lives around the world by elevating the care provision with better outcomes. But we can also do something very much needed for our planet, which is we can improve surgery to make it much more sustainable. And that is not one single company that will do that. That requires the entire ecosystem, like all of you here today, to work in unity towards this common goal. Thank you very much.
Thanks a lot, Michael. You did end up with a quote, so you're on track. Great. Who came from Abu Dhabi today? Great. 1 metered aerosol is an equivalent of 280 kilometers car ride. That's the way from Abu Dhabi and back. 1 metered aerosol. The pharma perspective, I would like to invite Dr. Sameh Al-Fangari, GCC and Pakistan cluster president at AstraZeneca, to join his insights.
Since morning, I'm sure that most of you have attended many sessions and you have heard that the climate crisis is a health crisis. But it has taken 28 COPs to nominate a health day for, to recognize the important link between climate crisis and healthcare crisis. And I'm just quoting our CEO who was in the plenary opening this morning and reflecting on learning from COVID and learning from the pandemic. We have lost during COVID around 7 million unfortunate deaths with the impact of the pandemic. Every year, we have reported death out of climate crisis like a couple of pandemics. And this is why I think it makes perfect sense that we work together. And I have seen, how we started to work downstream, because usually in such kind of conversation, we usually discuss about operation and supply chain, but now we talk about healthcare delivery and how we can be much more efficient into making sure that we making the desirable impact on patients, of course, transforming their life, making sure that health equity is there, but in the same time as well that we are doing it in the clean way to the environment as well, and in the most economic, aspects. If we'll put numbers again into perspective, that we see the pollutions and we see the impact of the climate crisis in our day-to-day life. We see it in the floods and the tsunamis and the high rise of temperature. But if we zoom in the healthcare sector, we report every 2 seconds a death premature in the age between 30 to 70 years old from non-communicable diseases associated somehow with the pollutions and climate change. So it's a significant one. And on the other hand, the healthcare sector itself is responsible, as the data being presented, around 5% of the overall carbon dioxide emission or green gas emission. And this is not a small number at all, because it's like the 4th or the 5th largest country emitting carbon dioxide globally. But more importantly, that because this industry is innovation and science-based, so there is a way to approach it from that angle and make an impact. So unlike other industries, that we have the science-based target is already embedded in the DNA of this industry, right? And, since creation of the science-based targets and being able to identify the baseline for each industry and for each part of the value chain to the patient, because here when we are thinking about the entire value chain, we are thinking from the innovation and R&D, from the lab bench up to the patient. And even, how the patient are utilizing, and even the waste after the patient is using the medication, for example, or using the services. So it's the entire value chain. Once we understand the baseline, we start to put targets across different domains in the operation and achieve impactful results. And I would here give a little bit of learnings from AstraZeneca. It took us from 2015 to date to reduce our operation emission of carbon by around 60%. We have reduced water consumption by 20%, waste by another 20%. And we have very solid plan that is not negotiable because it's again based on science-based target and based on KPIs that we follow through every year, that will reach a 98% reduction on overall scope 1 and 2 green gas emissions. So that leaves us with, when it goes in the scope 3, here the collaboration and partnership makes perfect sense because we cannot do it on our own, and we have heard it today from speakers. And thanks again, congratulations for the white paper, because when I was looking into the different domains in the Dubai Science Park white paper, I see lots of avenues for collaboration that we can really make sure that we are embedding it in our plans. Because scope 3 is all about partnership, and we cannot do it without that. And this is the biggest part of the remaining piece of to reach net zero. So the company was one of the first companies, AstraZeneca, first company to commit to a net zero by 2045 across all of the value chain, including the indirect operation as well, including delivery of the care to patients. So not stopping at the operation, which is quite ambitious. But we can see now, especially in the last couple of years, and especially after the COP26, where 13 worker groups have been formed across different industries, but there is a healthcare group under sustainable market initiatives for the private healthcare sector, and brought together private-public partnership in action, where our CEO, Pascal Soriot, is chairing that worker group, along with another 7 multinational pharma companies, and they do cooperate with the World Health Organization, and as well as the sustainable market initiatives of the United Nations. So we started to see that acceleration of the partnership globally, and we are proud as well that we are taking it here within GCC, locally. So this is maybe the first and only slide that I have, so I don't have 50 slides to present. But I think the reason of why I wanted to put that slide here is to recognize all of the partners that we are working with, because this is, of course, in AstraZeneca, we are very proud of what we are achieving every day, either globally or locally here. But the credit goes to all of the partners that we work closely with them to make it happen. And our strategy to reach to net zero by 2045, which fully in line with the UAE vision to reach to the net zero by 2050, is according to 3 pillars. So the first pillar is health equity, and we have listened to the importance in the EY white paper with Dubai Science Park about the importance of making sure that everyone getting the ideal care they deserve at the right time. So for health equity, we are focusing on bringing diagnostics earlier, discovering patients before they get sick, actually, before they go to being a patient. So here we target the entire population or at-risk population of reaching there, and driving policies that make sure that those people, if they are picked earlier, they create impact to the economy, and they create positive impact to the planet as well, to the health of the planet. And we'll be having data that driven by the UAE, driven in Saudi, that will be published, and which will show in different diseases, especially I'm talking about lung cancer, chronic kidney diseases, some respiratory diseases, where in the last 30 years we can see that lung cancer and death from respiratory illnesses increased by 160% only in the last 30 years. So those data will be published, and then it will hopefully work closely with the regulators to enforce protocols in the hospitals and with the treatment physicians. So we make sure that those learning that comes out of these data are implemented and driving practice change at the patient level. So this is for the health equity. The second one is for resilience, and this is what our biggest learning during COVID and during the pandemic. We have seen that the entire healthcare system got a shock, and many countries they were not able to cope with the mandate of the crisis. And the focus shifted towards vaccination, shifted towards protection, and many of the chronic disease patients have been suffering because they were deprioritized somehow, because the healthcare system was not ready to deal with such a shock. So immediately after the pandemic, we have worked globally with the World Economic Forum, with London School of Economics. The idea here was to bring academia, public and private sector into collaborating through a science-based and research-based platform. We call it PHSR, which is the Partnership for Healthcare System Sustainability and Resilience, that goes into understanding every country. So it's not something which is, yes, it's globally deployed, but locally focused into getting the understanding of the baseline of each healthcare ecosystem and putting a plan, scenario plans of, in front of future pandemic, how the healthcare sector should act and how the healthcare system should provision for the patients who are the most immunocompromised or the most vulnerable population that may suffer the most out of the strike of the pandemic. So this is the resilience part, the healthcare resilience part. And then the third piece is the climate action. So that's include the decarbonization of the operation, that include decarbonization even of the patient pathway, as we just discussed, but again, investment in the biodiversity. We can see now lots of initiatives for planting mangroves and trees, and making sure that we are offsetting the remaining part, because you will never reach a zero. So to reach a net zero, if you reach a 95, 98%, the remaining percent you should create, a kind of a balance back with the biodiversity and fixing what collectively have created as a problem for the planet in terms, and invest in the biodiversity. And of course, moving to more sustainable offices. We are very proud that we just recently moved our UAE offices to sustainable offices in Dubai Science Park. And we have same plans in Saudi as well and across all our operations in GCC. And we monitor how much carbon and emissions we save in those offices. So it's still very important aspect that we do in order to make sure that we are collectively, through our partners and through our teams who are really passionate towards serving people, society, and the planet, that we are delivering on our commitment. Thank you very much, and looking forward for the interaction during the panel discussion.
Thank you very much, Dr. Sameh, for the valuable insights from the pharma perspective. Last but not least, I would like to invite Engineer Dua Hamdi Srour, the Corporate Environment, Health and Safety Manager at the MediClinic Group in the Middle East. Please join us.
My name is Dua. I'm working in MediClinic for the past 13 years. I'm here in UAE for the past 18 years. So sustainability in healthcare, of course, we can say we have challenges to face and also a lot of opportunities. After all the 3 days from COP, we can see a lot of improvement and opportunities in all healthcare sector and all other sectors working in the UAE. So we can say it's navigating a path to a sustainable future. So today I will try to share some introduction related to sustainability in healthcare, how we can have a change in impact, climate change, how it's impacting the health and healthcare system, and what are the environmental impact as well from healthcare system to the environment, challenges facing the healthcare, and what are opportunities where we can find here in UAE for healthcare can work and start with. Sustainability journey, I'm preparing 10 points. It's very easy, like a tips where a healthcare organization and a hospital, a clinic can start working with. And also showcase from MediClinic Middle East and how we worked very hard during the past 3 years on our sustainability plans. Sustainability is a context of healthcare, involves a holistic approach that considers environmental, social, economic factors, create a healthcare system that is efficient, resilient, and responsible as well. Responsible because the healthcare facilities leaders must commit and must invest in sustainability as well. So sustainability in healthcare system defined as a system improves, maintains, and restores health while minimizing negative impacts to the environment, leveraging opportunities to restore and improve benefits to the health and health well-being of the patients and the future generations. Anyone saw this photo before? Yes, this is the earth compared to its water and air. we can imagine how our system is very fragile, what damages we are causing to our air and to our water. With the expansion of population surrounding in the worldwide, and we're still not conserving the water and damaging and causing air pollutions, what is remaining to us? So climate change is real and we have to act. So I am having here some tips related to the climate change impacts on the health and on health system as well. So we can feel what is happening from adverse weather condition, extreme heat, this having a direct impact on the health and population. Especially in the coming slide, we will show how vulnerable populations are having impacts related to this. This can cause related to poor air quality, cardiovascular complications, and also can contribute to health issues like mental health, depressions, and also can lead to anxiety. And as we see as well, the impact to the health system resulting from extreme weather conditions like flood, causing power outages, increasing the emergency service or hospitalization, which is really direct impact to the healthcare system and its resources. This is what I was speaking about, how extreme temperature and raising and elevating and rising of temperature can directly impacting a lot of different population and vulnerable groups. And this ranges from children to adults to women and elderly people, even people with disabilities, and how they will suffer a lot of health problem like kidney problem, dehydration, and many, many more illnesses, which also reflecting to the healthcare system. It's the same slide. We discussed that healthcare is having almost 5.4% of carbon emission related to the different impact in other industries. So we discussed about the impact of climate change on health and healthcare system. What about the healthcare system impact on the environment? Of course, there are a lot of negative impacts coming from health sector to the environment back. And as we said, part is related to the carbon emission generated at from healthcare facility. And it's really very important that we understand the impacts and promoting sustainability and minimizing the negative impacts with a lot of efforts from all healthcare providers. Energy consumption, discussion of previous speakers, how theaters and operation rooms generates and consumes a lot of energy and power. Equipment, chemical used for disinfection, sterilization, and other medical processes, which is dangerous to the environment. I will speak a little bit here about anesthetic gases because it's really having a huge impact on the environment. If we speak specifically about dysfluorine can stay in the environment for 14 years. And it's generating a lot of volatile organic compound which stays and pollutes the air quality. With generation, of course, resulting from all the surgeries and the clinical activities, pharmaceutical waste, medical waste, directly having an adverse impact on the environment. And of course, the single-use plastic. Also, previous speakers speaks about the waste generated in the surgical processes or the operations theater. Here is one of, I also added in the last slide, is very interesting research which speaks about the green surgeries. And the conclusion of the research speaks that the green surgeries can serve or reduce the emission 133 tons of carbon emissions a year. So we can imagine how this will be helpful on the climate change and how the healthcare sector can impact positively when it comes to sustainability and sustainability initiatives. Water usage in sterilization, in sanitation, and also in cooling system. Of course, here in UAE, we know that we can't live without the AC. So what about the medication needs to be stored in different temperature and to be maintained to control infectious diseases and transmission of infection inside different areas in the hospital. So of course this is duly needed temperature cooling. Transportation, of course, for patients, for staff, this consumes a lot of fuel, which is considered as well a support, a direct impact on the carbon emissions. The coming slide showing the challenges and opportunities. Actually, for the challenges, I keep just one slide. For opportunities, we have a lot of slides. So challenges, with the rising cost of healthcare system, with the technology and innovation, we have now robotic surgeries happening. This really is very costing. And imagine how the healthcare facilities will be able to invest in technology and sustainability together. So really, the funding and cost is one of the important challenges. The second part is resources density, which comes to resources consumption, like consumables, medications, which will reflect it to generating amount of waste. And also the technological advancement. Whenever the healthcare system investing on more technology, this directly will be leading to a lot and majority of electronic waste. If we speak about the opportunities, as we said, we have a lot of opportunities. UAE now generating a lot of solar and nuclear panel, ENIC as well, and all healthcare facilities having opportunity to generate and purchase clean air certificates. Leading Dama, of course, the UAE, we have a lot of standards and regulations speaks about how healthcare facilities can be designed in more sustainable way, circular economy, encouraging the recycling of waste as well. As I said, we have 10 points. Any healthcare facility, hospital, clinic can start utilizing when building their sustainability system. I can say it here, it's the way forward. So starting with leadership or assessing the healthcare system, environmental impact, especially we need to focus on energy, water, and waste. Also the leadership with commitment from the highest level of the organization, appointment and advocate, awareness and education, including patients and employees, and involving patients in sustainability decisions, campaign and awareness session as well, energy and fuel conservations, as well as water conservation. The other 5 points related to waste management, starting the segregation of waste, recycling plans, and we have recently in UAE a lot of companies, new service provider, environmental service provider, are able to recycle different type of waste. Even we didn't recycle before, starting 2 years now, we start working with them, building and design, how we can start building the hospital with a more efficient and sustainable way. Procurement and supply chain, which is contributing especially in scope 3 emissions, and how we can start to find a local resources, materials as well. Selection is one of the most important point. We have a very high level commitment from our head office in Southern Africa and the board and investors, and really they invested a lot. So we have started working on our ESG strategy, environmental, social, and governance, with a very ambitious goal to reach to carbon neutrality by 2030. And really, we have amazing results coming on zero waste to landfill implementation of environmental management system, and we picked up ISO 14001 implementation. We have zero emission in all our facilities in Abu Dhabi. We purchased the clean energy certificate by AWIC, and till now we are the first healthcare provider for doing this activity. Stop using the disflurane at all from last year. Waste reduction and recycling initiatives. We have 71 of our energy now. It's on site through solar panel and BVT panels as well. We replaced all our fleet cars to hybrid cars, and this really helped us. I don't have the real figures right now, but really the figures are really great and also very cost saving. When we invest in sustainability plan, this will comes back to us as well. Stop using the plastic cups. We have the keep cups for all our staff, replacement of the bags. I believe this was amazing initiatives by the UAE government when all of us now going to hypermarkets using our own bags. Working with non-government organization, really, this is really amazing when healthcare contributes to educate the community and involves the community. Our patients enjoying with us for desert cleaning and planting trees and mangroves, and we always celebrate our success. And I really encourage each member sitting here working in healthcare facility. Once you plan and achieve, you have to recognize your team and you have to celebrate. This really makes a huge difference. And I'm happy that today we got recognition from Department of Health for our sustainability initiatives. We call it in Abu Dhabi Emerald Sustainability Key Performance Indicators, and we got the awarding ceremony from His Highness Sheikh Mansour al-Mansouri. So this is my last slide, which is, I can say, like closing thoughts and take-home messages. Climate change is happening now, affecting our health and our healthcare system. So climate change is real. It's required to be ready and reinforce our resilience. Opportunities in place start with sustainability actions for ourselves, our planets, our communities, and our planet. Start anywhere. But remember to prioritize and focus, set your targets, engage with everyone, and appoint an advocate. This really will help the people leading the sustainability plans. And my advice, to start in healthcare, you must put a nurse in your team. Sustainability is a journey full of challenges and changes. It's a start with a commitment, and it's powered with innovation. And the last point for today, small acts can make a huge difference. Just we have to start. And as COP say, let's unite, act, and deliver. Thank you very much.
Thank you, dear speakers and panelists, and welcome on the stage. Your organization's commitment to sustainability in 60 seconds. How would you summarize that?
I think in a 60-second summary, THP's commitment to sustainability is really centered around how we personalize health and care. One of the big things that we do is we work with healthcare providers to address and close care gaps. So by that addressing and closing of care gaps, patients are able to make sure that they get the right level of care. They're able to make sure that they don't have any duplications. They're able to make sure that they are not taking any unnecessary medications, and they're able to go on predefined care pathways to make sure that they get the best clinical outcomes and don't have any other comorbidities or challenges.
We obviously want to make sure that surgery is much safer, smarter, and sustainable, and that actually starts by living and breathing what you preach. So with all the various procedures, the tools that we're using internally, we're trying to have renewable energy for all our offices, as well as the way that we obtain the energy for the data centers. Then when looking at various different consumables, trying to always go green. And you have to walk the talk, not just talk the talk. And only then you can bring that into practice also on how we are developing our products and services, how we're delivering value for the ecosystem. We want to be an integral part of that entire journey and want to do also what we need to do to contribute.
Yeah, so I think that within AstraZeneca, we always push the boundaries of science. So we are always inspired with what science can do. And if I would summarize the commitment is, again, it's for better health for the people, society, and the planet. And what we can see here that we are, when we talk about people, it's more about even before they become patients. So how we can prevent them from, going into being patients. And if we're talking about society, so the economic value. So it's no more now discussion about the impact and the price or the cost, short term and long term. It's more about the overall economic value, and I think we have presented on this one. Last but not least is the impact on the planet. So we see that the price tag for any product in the future will be carrying a benefit for what is created for, an impact on the society, which is more of the overarching economic impact, and impact on the planet itself. So for people, society, and the planet.
Actually, I can say it's also 3 words: commitment, engagement, and delivering. Commitment coming from our board, and they already eager to invest in sustainability. This is really, when we say it's in private healthcare, it's not an easy to invest millions of dirhams in sustainability, but the board believes that this will come back. We put in the heart of all our actions patient safety. We look to the environment as a very valuable asset, and as we impact on it, it will come back to us. So we take care about this engagement of our teams and patients. Really, it's a very important point Mediclinics believes in, and the key factor is the behavioral change when it comes to sustainability. Really, which we really have to start working is building a culture, starting from the hospitals and employees, going back to their families, interacting with the community. And as I said, it's a continual improvement. We set our targets, we monitor, and we keep progressing and improving. Nothing is perfect, but we try to reach to the best.
Thank you very much. I think if we look at healthcare in general, around 30% of waste and lack of sustainability is created in the manufacturing side of tools and equipments and medications and so on. And including the cost of fuel and the cost of energy to that manufacturing. And around 70% goes downstream and upstream when it comes to delivering that care to the hospital and administering healthcare needs to the patients. We have in the panelists stakeholders who sit upstream and stakeholders who sit downstream. From a policy perspective, where do you find the utmost need for a policy change that would improve sustainability adoption upstream and downstream?
When it comes to the reporting requirements that health facilities have to go through, and particularly in the surgical continuum, a lot of instances the reportings are being done in Excel spreadsheets. They might be uploaded somewhere, or even worse, in Word documents or paper written notes. And the reason for that is that there is no proper data backbone. And by having only fractional data, you will never have the holistic view. You will never be able, also from a regulatory standpoint, to gain the insights, to really have a good measurement of the quality of care and what is the impact to the entire environment, the ecosystem, which you do need to have to put the right incentives in place to ensure that you are supporting what needs to be supported, but also putting let's say, a close on something that needs to stop. So from a regulatory and policy standpoint, I would appreciate that more and more the digital transformation is not optional, but has to be there as a foundation, because only then we can utilize across, not only surgery, across the entire healthcare continuum, the data points to gain the insights to improve care provision, but at the same time to also make sure that we have the right incentives in place if a specific industry is not advancing on something. Ultimately, they always will follow what they're incentivized by, right? You know the lovely saying, culture eats strategy for breakfast, incentives eat culture for breakfast. So if we have misaligned incentives, people will always do what they're incentivized about and not what is right culturally.
What we need now is more of incentive on a back of science-based targets across all of the value chain, because the value chain upstream and downstreams is not like handover. Like R&D handing over to manufacturing, and then manufacturing handing over to supply chain, then supply chain handing to hospital or doctors to patients. But it's one value chain where handshakes are happening. And if we look into how the sustainability goals and net zero goals is being defined into scope 1, 2, and 3, majority of the effort will be on scope 3. And the scope 3 is happening in the handshakes. So it's not happening in what I control as an operation. It's handled by how I could, collaborate across the value chain to create the impact. And that's why the incentive need to clarify these kind of handshakes, how it will be incentivized, because you can easily say that it becomes license to operate, for example. A reduction of energy by this much, reaching net zero by this year. But what happened across the value chain and how I can use it as more of financial and economic incentive for businesses to invest, because it's an innovation. Innovation means investment, and I think Dr. Dua has mentioned this during the presentation as well, that if we stop innovating and we only look into the sustainability goal as more of dashboards and KPIs, we may be actually stopping kind of the next generation of innovation that we kept on getting it in the last couple of decades.
Great. Mr. Jamie, if you would look at emerging technologies such as AI and telemedicine, how can adopting these technologies help in fostering sustainability downstream?
I think some of these new technologies are actually going to be very key and instrumental with how we adopt and how we identify sustainable healthcare. I think one of the big areas where it can support is unwarranted variation. So when we deliver healthcare at the moment, we're very patient-centric, as we should be. But also one of the levers and one of the things that we should be conducive of is sustainable improvement in clinical outcomes. And if we can get to a baseline where we can understand how that can be completed, that's very important. So we can use tools like artificial intelligence, tools like I mentioned earlier, generative AI. If we can understand the what and the why, and then we can move to the prescriptive way of addressing that based on the knowledge and the insight of how can we deliver the best patient outcomes in the most sustainable fashion across a care pathway.
Great, thank you very much. And Engineer Da, from an operator or a healthcare provider standpoint, in terms of strategies that can be implemented on the ground, incentives that can be given to healthcare providers, and let me open a controversial area a little bit when it comes to incentives from insurance and payments. So my question is for healthcare providers, if insurance and payers in general don't incentivize you and still pay you the same cost for treatment for all practices, what incentivizes different practitioners to adopt sustainability measures versus not adopting them?
We started the telehealth since the COVID hits, right? And you can imagine that the cost of a telehealth is much far less compared with a physical consultation. So we are in a challenge between increasing the innovation, and we have to go green, and saving carbon emission of patients coming to the hospitals. And at the same time, this is not giving a rewarding to our revenue. Again, I can say it's coming from the healthcare providers themselves and how they believe that really we can invest on this. We are investing a lot in building new telehealth system and how we can enhance home delivery, home care service. Now it's everything. Now it's working on a technology perspective. Insurance companies and health sector and government as well have to look how we can incentivize the healthcare providers to promote the sustainability outcome based on outcome. They can set KPIs, for example. And I believe Department of Health started doing the Emerald Sustainability KPI to monitor the progress. And I believe 100% this is in the coming few years will be reflected with the rate of the payment for the consultation services.
Great, thank you very much. Let me move the discussion to the patient. We all operate at the end of the day for the patient. If, according to the statistics we showed at the beginning of the talk, that only around 4% give importance to sustainability in healthcare, which makes it quite difficult to, if you tell patients, for example, I would use this specific procedure, or I will put you through more pain, or I would give you some solution that is probably more difficult for you to use, but it's more sustainable for the environment. From your perspectives, pharmaceuticals, operators, health providers, technology, health tech and fintech, what's one intervention or one solution that you've been developing in collaboration or co-creating with the patient to increase the adoption by the end user, if we can call patient a user, by the end user to your services? Maybe we'll start with Mr. Jamie.
I think it's beholden on us as healthcare practitioners to actually provide these kind of platforms to our citizens. So from our perspective, we provide a platform which is a digital intervention and nudge-based platform, which just helps keep citizens and patients on aligned care pathways. It helps educate around specific conditions. If they do have a chronic condition, they make sure that they attend checkups properly, they adhere to medications. If they're diabetic, as an example, they go for the diabetic retinopathy as well as the foot checkup. So it's a guided care pathway which drives better clinical outcomes. And as a consequence, it's
better and more sustainable, because they don't develop those comorbidities, they don't develop those other healthcare challenges that may need additional visits to facilities, medications, etc.
I'm sorry, perfect. Mr. Michael?
I believe we still have to fight a stigma that sustainable means it's more expensive. And as long as we do not get that out of the heads, I mean, we saw wonderful examples today. Sustainability and sustainable approaches make a lot of economic sense. And that is what literally everybody in the ecosystem has to understand. Sustainable doesn't mean it will cost money, it can save a lot of money, it can be much more effective, much more efficient, safer, better outcomes for everybody involved. But that brings me to a little bit the incentives again, because ultimately, particularly in healthcare, I know we want to go towards value-based care. Don't get me wrong, that's where we have to get to. We still have revenue-driven healthcare, and we have to get away from that, but we also have to understand that if we do not follow the money in healthcare and create value for every party along the way, we will not create a change. So we have to bring that ecosystem together.
If everyone within the ecosystem understand what Michael was just referring to, that sustainable innovation saves lives, it saves money, and it saves the planet as well. And if you look into even value-based care or whatever, it has to be the three of them together into the equation. And just an example, because I've tried to put on the slide many of the initiatives that we have done AstraZeneca here in the UAE and in Saudi Arabia or across GCC countries. But the recent one is try to change policies through data. So looking into Saha and Pure Health into the patient journey of the chronic kidney disease patient. And if this patient was discovered at stage 1 to 3 instead of stage 5. Stage 5, the patient goes hemodialysis. And with the data, it's showing that 450% increase of the green gas emission per patient per year, only if they progress into stage 5. So imagine if regulators take these data and start to put protocols of screening, and we have technology that goes with artificial intelligence with the health record to identify the high-risk patients, and they can treat them early before they progress into stage 5. So it has an economic value, and definitely it needs to have very solid incentive as well for everyone who's doing something regarding it.
I would like to thank everyone, and I believe if we summarize everything that we've heard today, it goes around the ESG goals, having clarity in how your business or where you stand within the ecosystem and within the value chain adds to the environmental, social, and economic aspects of sustainability of healthcare, and how policymakers can drive the change through small tweaks, and how this value can be portrayed to the businesses equally as they can be portrayed to the end user or end recipient of the care, which is the patient. I would like to thank Advanced Health and Dubai Science Park, Marwan Abdelaziz Janahi in particular, for having this as a core focus area for Dubai Science Park, investing time and effort in bringing all the stakeholders together to discuss such an important topic in such an important event. So thank you so much for that. Thanks for all the panelists who cut out of their time, precious time out of their days to come here and discuss those points with everyone else. On behalf of Dubai Science Park and Marwan Janahi, I would like also to thank everyone who has attended today. If you have any interest in receiving the sustainability component of the Dubai Science Park white paper, please scan the code, enter your details, and you will receive a copy on your emails. And stay tuned. It will be launched very soon. Thank you very much.